Welcome to The Explainer. Today, we're unpacking a really challenging argument, one that kind of flips the script on what we think we know about heart disease. What if the familiar suspect isn't the real culprit at all? Okay, so let's get right to the heart of it with this one big question. If LDL cholesterol is the bad guy that causes plaque, how come we only see that plaque in our arteries and not our veins? I mean, think about it. Your arteries and veins, they're part of the exact same circulatory system, right? They're swimming in the same blood with the same amount of LDL, and yet somehow only the arteries get clogged up. It's a real head scratcher. And this really lays it all out nice and simple. Same LDL exposure, totally different results. Arteries get atherosclerosis, veins don't. So if high LDL was the only factor, the sole cause, this just shouldn't be possible. It doesn't add up. And this little contradiction, well, that's the key that's going to unlock this whole different way of thinking. So if it's not just about having LDL floating around, then what is going on? Well, to figure this mystery out, the source material we're looking at points to this really fascinating clue, and it comes from a place you might not expect: the operating room. And this is just a brilliant piece of the puzzle. So get this, in bypass surgery, doctors will often take a piece of a vein, from your leg or somewhere, a piece of tissue that would never get plaque on its own. But when they graft that vein onto an artery, putting it into that high-pressure, high-stress environment, bam, it starts developing atherosclerosis, just like an artery would. So it's not the tissue itself, it's where you put it. So what does that tell us? It's a huge clue, right? It's pointing away from the LDL in the blood and pointing directly at the environment, the physical forces at play inside the vessel wall. So let's zoom in a little closer and see what's happening on a molecular level. All right, so the source material brings up these molecules called proteoglycans. Now, the easiest way to think about them is like they're little strips of molecular Velcro inside the blood vessel wall, and their job is to basically snag LDL particles that float by. But, as we're about to see, not all Velcro is the same. And this is where it gets really interesting. It's not that veins have none of this Velcro. It's about how much they have and how sticky it is. Arteries are just packed with these super sticky components, these GAGs, that are incredibly good at grabbing onto LDL. Veins, they just don't have nearly as much. It's a huge difference. So naturally, you have to ask the next question, right? Why? Why do arteries have so much more of this LDL trapping stuff? Is it just built that way from the start, or is it something else? Is it maybe a reaction to the unique job that arteries have to do? And this is where the whole argument really pivots. The source we're looking at introduces something called the injury hypothesis. And this idea, it completely reframes the whole problem. It shifts our focus away from chemistry and puts it squarely on physics. So here's the absolute crucial point. According to this hypothesis, the whole process of forming plaque doesn't start with cholesterol. Nope, it starts with actual, physical, mechanical injury to the super delicate inner lining of our arteries, the endothelium. And this injury isn't random. It's not happening all over the place. It's caused by the physics of blood flow. When you have high blood pressure, the blood doesn't flow smoothly. It gets turbulent and chaotic, especially at predictable spots like bends or where an artery splits into two. Just imagine a fast-moving river hitting a bunch of rocks. That churning water is what's happening inside the artery, and that turbulence is what's physically beating up and injuring the vessel wall, day in and day out. So let's walk through this new chain of events. Step 1, high blood pressure. That creates step 2, turbulent blood flow, which causes step 3, physical injury to the cells. Now, what does your body do when it's injured? It tries to repair itself. And that's step 4. The injured cells start producing more of that sticky Velcro, the proteoglycans, to trap LDL. And why would it do that? Because LDL is basically a little delivery truck packed with cholesterol, which is an absolutely essential material for rebuilding damaged cells. So the plaque itself, that's just the scar tissue, the result of this repair process happening over and over and over again. So you see how this just completely changes the story, right? Suddenly, LDL isn't the villain. It's not the bad guy. And to really drive this point home, the source uses this fantastic analogy. It's like this. We don't blame forest fires on the fire crews that show up to fight them, right? And according to this hypothesis, blaming heart disease on LDL is doing exactly that. You're showing up to the scene of the crime, seeing the first responder, the LDL, and accusing it of being the arsonist. The argument is that LDL is just there to do its job, to respond to the damage. So, here you go, the two views side by side. On one hand, you have the conventional story. LDL is the arsonist, it's the cause of the plaque. On the other hand, you have this new idea. The injury is the cause, and LDL is the fireman. It's just part of the body's natural response to that injury. Two completely different ways of looking at the same problem.
Okay, so let's step back for a second. If we follow this line of thinking, if we buy into this injury hypothesis, what does that actually mean for how we understand heart disease at its most fundamental level?
Well, the conclusion is pretty profound. It means that heart disease, at its very root, isn't really a cholesterol problem. It's not a chemical imbalance. It's a mechanical problem. It's a disease of physics, of pressure and turbulent flow. Which means the real disease, the primary problem, is hypertension. And here you have it, the entire story from start to finish. You start with hypertension, that leads to turbulent blood flow, which causes endothelial injury. The body kicks off a repair response, and that's where LDL comes into the picture. And the long-term result of that ongoing repair is atherosclerosis, a clear, logical progression from cause to effect. So we wanted to lay out this particular scientific argument for you, because it really does challenge a lot of what we take for granted. And it leaves us with a really powerful question to think about. Is LDL the arsonist that starts the fire, or is it just the first responder on the scene? In other words, have we spent decades focused on the firefighter, while the real arsonist, the injury from high blood pressure, got away?